Hi, my name is Bimal Maharjan. I am GI survivor and a GI advocate. I went through the US healthcare system as a chronic constipation patient, and these facts surprised me. Today, I'm going to list my top 10 surprises from navigating the US healthcare system. Let's dive in. Let me list you the 10 different points that I'm going to talk about today. Number one is old school appointments. Number two is paper trails. Three, hidden cost of preventative care. Four, test gaps in preventative care. Five, mystery pricing. Number six, negotiating the bills. Number seven is confusing billing. Number eight, aggressive collections. Number nine, healthcare is free if you don't pay for it, depending upon where you live. And number 10, healthcare is sick care. So let's go to these points one by one. And I came to the United States in 2016, and my first doctor visit was in December of 2016 as a routine preventative care. And many things about that surprised me. Remember, I came from Nepal, a developing nation, and my expectation about United States was I am coming through the most advanced nation in the world. And I felt like everything is going to be very advanced. But the healthcare, right from booking an appointment, this was very archaic. It's like 1999. We book everything online. For this, we have to call, text, or either go in person to book an appointment. That surprised me a lot. And I asked, why is that? And today it's still 2024. Most of the things have not changed. Still, it's phone calls. Even to book your primary care, your specialty care, your dental care, everything is just phone calls. Why is that? That's so surprising. And I know why. I'll tell you about that in the 10th point, which is healthcare is a sick care. It's all about incentives. It certainly surprised me in 2016 when I visited the doctor's office for the first time. There was a long paper form that I need to fill out. Okay, it's the first time, it's understandable, they don't have any data. But in every visit, I need to fill that form out. And I ask myself, why can't it be a digital form? I can use out using filling an app or the iPad form. And also for second time, why can't they just simply get the form from the previous one and I just fill out the differences? And why can't I even fill that out from home? And there are some applications that I can fill out from home, but the communication to the patient is so tedious. Most of the time, I don't even know about it. And we in 2024, we are stuck with filling out the paper forms. That was very surprising. As I said again, I thought I came to the most advanced nation, but these are very rudimentary. And that surprised me a lot. The third is the hidden cost of preventative care. I was surprised when I got a $25 bill in 2016 after my first visit. And I called them and asked, what's that $25 for? And the answer I got was because I asked a question that was not the part of routine preventative visit. And I was baffled. So, as a patient, how would I be aware what is covered and what is not covered? What questions should I ask and what questions should I not ask? As a patient, my priorities should be discussing my health concerns with my primary care doctor when I go for preventative visit, not to be bothered or confused or even concerned about, hey, here are a list of things that are covered and here are not list of covered, and I should not ask for any other questions. And even before that, should I be asking my doctor whether it's covered or not? Doesn't it negate the purpose of preventative care in the first place? And in my first bill, it was $25. And I still didn't get the concept of hidden fees in a preventive care. But in my second visit, in the second year, it was much more than just $25. And I should not be asking health related questions to my primary care doctor. It cost me money for every question that I ask. That was baffling to me. And I wondered today, when I go for a doctor's visit, I don't ask any questions. Do whatever it requires for you to do. And as I again said, it beats the purpose of preventative care. Preventative care should be about not bothering about the bills, but about having a transparent, open conversation with my primary care doctor so many diseases can be prevented. But it's just opposite, and I'm concerned about the hidden fees or hidden bills I would get if I ask the question. And number four is test coverage gaps in preventative blood work. In the same 2016, my first visit, they gave me a panel of blood work. And as a first time patient, I obliged and I got those tests done in the same lab in that healthcare clinic. And after some time, a couple of days, I started getting the bills. And some of the things that were not covered were surprised me. For example, the vitamin D level test. I live in Boston, where most people have vitamin D deficient, and it's common in New England area that I was told, but that was not covered. And again, my assumption as a first time patient going to the doctor's visit was everything that they prescribe or they suggest to get the blood work done in the preventative care would be covered. But surprisingly, it was not. And that's another surprise. There's a lot of hidden fees and it's very itemized. This is covered, that is not covered. And for a patient, it must be very grueling to understand what's covered and what's not. So for you, when you go to preventive care or specialist care, please ask what is covered and what is not covered when a doctor prescribes you for the blood work as well. As you can see, the level of surprise is increasing. And this is the beginning of even more surprises. Number five, which is mystery pricing. In 2020, I had to go through a colonoscopy procedure. So this is what I did. I tried to shop around for where is the most cost effective clinic that I could get colonoscopy. And you know what's the surprise? Nobody could give me a quote. Then I went to my default option to my to the specialist to whom my I was visiting, and that specialist was referred to me by my primary care doctor. And upon conversation with them, I understood that it was a preventative colonoscopy, therefore, it should be done at zero cost. Remember, preventative. So I go through the colonoscopy procedure because that's the default one. I have to pay $0. So why don't I just simply go through it? So remember, at this point of time, I try to shop around. Nobody gave me no correct pricing. Then I resort to a default mode, which is $0, which I understood that is a preventative one. But after the procedures, I started getting the bills. It's $3,700, amounting to multiple itemized bills. So it was very confusing for me. And it leads to our sixth point, the negotiating the medical bills. Remember this, before I went to the procedure, I even called my insurance company, and got a pre-approval for my procedure stating that it is zero cost. But it came $3,700. The reason why is it was billed as a diagnostic instead of preventative. And nobody can change that. And this is what the mystery is. It depends upon the billing codes, whether it's going to be diagnostic or preventative, whether it's in network or out of network, whether you have a deductible, co-pays, and so on. It's very confusing. And then obviously, after I started getting the bills, I was baffled by the bills. And this is where another surprising fact about negotiating medical bills surprised me. You can actually haggle to pay for the bills. And obviously, outcome may be variant, but you can haggle. For that, you have to go on a call with the insurance company. You have to actually call the hospital or clinic and say, okay, I can pay this or not. And depending upon the state, you may have financial assistance and so on. For you, I would request you to go through all of these points. And for me, it was very sure, I was very clear about these things. I wanted to ask, why was it billed as diagnostic when I was told it was preventative care? And I told them point blank, do you expect me to be a billing code expert or PhD in billing codes so that I could ask you point blank or categorically that whether it's covered or not, whether it's a diagnostic or preventative. I should not be. Even if I should be asking that question, isn't it the insurance company's job to educate me, at least hint me when I ask for pre-approval? Isn't it the provider's job to hint me whether it is covered or not, and what are the conditions that billing may be different? So my condition was, hey, there are three different stakeholders for it. I'm ready to pay for my share because I didn't ask, and also you didn't even educate me. So responsibility is among three different partners. So you pay one third, I pay one third, and the insurance will pay one third. But they didn't budge. Again, for maybe other conditions, you can negotiate and haggle, and this haggling is possible. So at least haggle. This leads me to talk about our point number 7, which is confusing bills. Imagine going to a restaurant, you had your meal, and the waiter gets you the bill, and you look at a bill and see, okay, there is the following thing. Number one, there is a restaurant fee for using tables and the land, which is called facility fee. Number two, there is chef fee, there is server fee, there is supplier fee for the ingredients, and so on. Won't it be very baffling? This is exactly similar in the medical billing. In my colonoscopy billing, these are the itemized bill I got. Obviously, the hospital facility fee, there is provider fee, there is all the equipment and the materials used fee, and there is anesthesiologist fee. Surprisingly, on that particular day, that particular anesthesiologist was a consultant anesthesiologist, not the employee of that particular facility, and I get bill from a separate company. I had never heard about that company, and when I look at the name of that particular company, I was shocked. And obviously, none of those were in my control. Then I wasn't as educated about the billings as I am today, but I was shocked to see that itemized bill. I should be paying for the colonoscopy procedure as a whole, not for the itemized bills. And these itemized bills, the more items they could add, the more the bill is going to be. And all of these put together became $3,700 for me. So when you get the bill next time, look at that particular bill and you will be surprised as well. After this confusing billings, I get even more baffled. The $3,700 of bill, which are supposed to be $0. And obviously, I would negotiate with all the stakeholders. So while I was doing that, it crosses a certain deadline. And to my surprise, to my shock, I started getting letters from collection agencies. Then I still am negotiating with insurance companies and providers. And after letters, I started getting phone calls. And it was very emotionally stressing out because I don't know what these collection agencies can do. Is it going to impact my credit score? Is it going to impact my prospects for employments? Is it going to impact my residency in the United States? Is it going to be a lawsuit? It's very emotionally stressing out. And again, the bombardment for collection agencies was not from just one collection agency, but from multiple different agencies. Remember, hospitals sent one bill, providers sent another bill, and the even anesthesiologist sent another bill. So each of those companies or each of those stakeholders have separate collection offices, and they bombard me with letters and phone calls. And it was very aggressive, weekly and then calls. But obviously, I dug deeper and realized, and in fact, one of the collection agencies I talked to, I sent them, hey, we are still negotiating. I think this collection are premature. And that was enough for me to hold them off for a few months. And while I hold them off, I kept on negotiating with insurance companies, but to no avail. They said that 100% of the bill was on me, and no way in hell I was ready to pay for that because it wasn't my mistake. I would still be ready to pay for my one third of the share because I genuinely believe that is not my mistake alone, even if there was a mistake. I don't think it was my mistake. It should be a $0. Even if it was mine, it should be a part mistake. It should not be 100%. But the system said 100% is not on me. And that the rebellious nature of me came out and said, no matter what happens, I am not going to pay for it. And fortunately, I live in Massachusetts. And that's point number 9 that I'm going to talk about. And this is ninth surprising fact. Healthcare is free if you do not pay for it. Fortunately, I live in Massachusetts. There aren't many consequences for not paying the medical bill. However, there used to be. I learned that it used to impact the credit score, it used to impact the debt score, it used to impact the lawsuits if the hospital systems and insurance companies file a lawsuit to the patient. And obviously, these are all variable depending upon where you live. For me, I didn't. I found it to be safe and risk free and consequences free not to pay the medical bill. And I didn't pay for it. And I did get what I deserve, the zero cost. It should have been the zero cost from the beginning, but there was a lot of confusing about the bills, a lot of confusing about collection agencies, a lot of confusing about understanding whether preventative or diagnostic. After going to the grueling 6 months, I think more than that, understanding this, I realized there is no consequence for me not paying for it. And I don't feel great about saying that. I want to pay, but I don't want to be taking 100% of the burden because it wasn't my mistake. So, number 9 surprised me the most. It's free if you don't pay for it. And we have reached to the most surprising fact. Number 10, healthcare in the US is a sick care. The incentive is in the intervention, not in the prevention. For example, as a patient, I had to choose the healthcare, health insurance every year. If you compare that with auto insurance, if I drive safely, every year my risk reduces and my premium reduces. So there is something in my control to do that because I can be in a long term relationship with my auto insurance provider. But it's not the same with the healthcare insurance provider. Every year it resets. No matter what I do, I eat well, I take care of my health well, the risk profile doesn't change, and my premium, there is only one direction that it can go. It's up. That's one surprising thing about why US is a healthcare sick care is in the incentives. And that's the reason why I talked to you about point number 1, why the healthcare system doesn't have the incentives to produce advanced digital systems because incentives are in the complexity, maintaining the status quo. Unlike any other industries, the industry on other industries have incentives to simplify and adopt newer, more advanced technologies. But here in healthcare, the longer you keep rudimentary, the more you can build, the more revenue that you can generate. And there is no control on the patient side that one can reduce the premium cost. And the premium cost is extremely expensive. It's hundreds of dollars from the employee's side, which is patient side, and also the employer adds that every month it can account for thousands of dollars. That's second point. Premiums are extremely high and only it can go up. And third point is that there are different categories of insurance that you can purchase. And depending on that particular category of insurance plan, your copay, your deductibles are different. And that's what makes it more complex. Hence, the status quo is to maintain higher payments, incent the procedures. And that's what it is. US healthcare is not a healthcare, it's a sick care. And even the preventative visits I talked about is not a preventative visits, it's just a routine care that they can bill you for. And it's like a fake preventative care in my experience. And I am yet to benefit from the preventive care, but I still go for that so that I can get some basic things checked and some basic blood works done. I still avail to my preventative care, but I don't ask any more questions because I don't want to get billed. So these are my top 10 surprising facts about the American healthcare system through navigating it as a chronic constipation patient. And because of this experience, I am able to crystallize the 5 fundamental truths about it in order to navigate it further. So the next chapter is about that fundamental truth. Stay tuned. Also, I love to learn about your experience navigating the US healthcare system. What surprised you the most? What disappointed you the most? And what satisfied you the most? Please comment. I love to read your experience and also engage with you. Furthermore, I request you to like, subscribe, and hit the bell icon so that you can get more insights about gut health, gastrointestinal health, and gut microbiome. You can get more evidence based insights from gut sphere.